ladies, good morning, good afternoon, good evening, and good night to those that are going to see this video in the night following the post that I made on the 1 week postpartum experience. I want to thank each and every one of you ladies that shared their experiences that were so raw and so genuine, so vulnerable, which was so uplifting. In the comment section, I noticed how everybody was interacting and encouraging each other. That was so appreciated, and I am sure a lot of women will benefit from reading all your comments, all your experiences, and just by them knowing that even as they go through so much hardship, so much confusion in the postpartum period, they are not alone and their feelings are valid. Their experience is real. What they're feeling is real. Other women have experienced them also. It is so encouraging to know that you're not alone. So I also noticed some comments that bordered on postpartum depression, which some women went through but was probably not identified. Luckily for most of you who shared, women came out of it. But I thought I should share general tips on what to expect in the postpartum period and just share a few symptoms and signs that you should look out for in order for you to seek urgent health consultation, or so that you get help. So what to expect? We call the postpartum as the 4th trimester in our field, because this is not a walk in the park. As much as pregnancy is like 1st, 2nd, and 3rd trimester, the journey continues after delivery. And for most of the time, people expect that, oh, you have delivered, now it's over. The attention may just shift to the baby, forgetting what the mother is going through the healing process, the trauma of what the birth went like, and the expectation to care for the newborn. It can be so overwhelming, and so the journey continues way beyond the postpartum period. And just to highlight that the timeline for healing after delivery is not the same for everybody. Yes, we have a standard follow-up of up to 6 weeks as a health sector, but we recognize that postpartum healing can take months, up to 12 months, or even years for people to heal from the trauma of what they went through during delivery or during the pregnancy. So what are the general things to look out for in terms of your health in the postpartum period, especially the 1st week? First of all, soon after delivery, your postpartum begins. You need to ensure that you are looking out for signs of heavy bleeding. You make sure you're not bleeding profusely. If you feel like you're soaking a lot of pads and your bleeding is generally getting heavier, then you should seek help. Generally, the lochia should be getting lighter. You may have a bleed every now and then, but it should be generally reducing as time goes on. If it's getting heavier, you need to seek help immediately, because PPH does not only happen immediately after delivery. It can happen maybe days later. So do not wait if you notice that you're having heavy bleeding at home. The other thing to look out for is pain. I can assure you that there's no medal for who endures the most pain after delivery without medication. There are so many options, and the pain management can always be escalated according to your need. So especially after vaginal birth, I think we don't do a good job. We just assume that people will just walk out of the delivery room and put the baby on their back, and they may not feel any pain, and they'll walk home majestically. But that is not the case. The perineal area will be sore, there'll be stitches, the uterus will be cramping, there's pain from the breast, and just your whole body will feel different after delivery. So Just advocate for yourself to ensure that you get adequate pain medication. Sometimes you'll be feeling so sick just because your pain is not managed adequately. The other thing we need to prepare for is breastfeeding. I think we don't do enough, especially for first-time mothers, to warn them about sometimes delay in milk production, the pain that you feel on your breasts and nipples when the baby just starts breastfeeding. It gets better with time. Most of you can attest to that, but the first week can be rough and surprising for those that did not expect it. So in terms of feeding, if you can, maybe even prepare to have a supply of milk in case there's some delay in the breast production, because it can be so frustrating that the baby is constantly crying and you're not able to feed. Also, make sure that if you notice any cracking on the nipples or pain that is excessive or swelling that you can feel on your breast, you should alert your medical provider so that they can manage any engorgement or any infection. Even pus sometimes can develop in the breast if there's an infection that is not managed appropriately, and this can disturb the bonding with the baby. It can lead to unnecessary hospital visits, so you need to take care of that aspect to ensure that the feeding after delivery is smooth. Let's talk about postpartum blues. This is a common experience for most women. Over 80% of women will feel sadness. You know, you can cry with your baby, feeling overwhelmed, feeling like you're not doing enough, like you are struggling, like you're failing your baby. This may be a normal experience because you're trying to adjust. It's a difficult transition from having your baby after pregnancy. If these symptoms persist beyond 2 weeks, then we may be worried that you may be getting into postpartum depression, and this may need the care of your provider. So if you have persistent sadness, severe anger, or rage or irritability, failing to sleep at all, even when the baby is resting, like you're just struggling to fall asleep, feeling like your family can do without you, like they do not need you, feeling of guilt or weightlessness, or just failing to eat, like losing your appetite completely, having intrusive thoughts, you know, that you can't control, feeling like somebody's out there to harm you, or this baby is out to get you, to make your life miserable. If you can't concentrate, you're indecisive, or having thoughts of self-harm, or thinking about harming your baby, this might be a red flag which would need you to see your provider immediately for help. So what are the red flags in summary? Feeling sad for more than 2 weeks, not finding joy in the baby, having thoughts of self-harm, feeling like your family can do better without you, having thoughts that you can't control, uncontrolled anger or rage, failing to eat and failing to sleep. Even when the baby is resting, you just can't sleep. This is a red flag. You may need to consult your provider immediately, especially if you take a number of these symptoms, maybe more than 2 or 3. You need to seek help. So how can women and couples and generally families prepare for this postpartum period to make it a better transition, to improve the experience for women? We need to work together as a couple. Men are key, and even them can suffer from postpartum depression. So together as a couple, or with whichever members of the family that support you, you need to plan for the postpartum period. You need to set boundaries, and for us as family members, we need to have boundaries and just render help to this. We need to be mindful about visiting the parents, the new parents. only really visit if you're going to render help, and keep the visit really short. And this is not a time that you'll be expecting, maybe for example your in-law who's just given birth, that when you visit she should be the one to save you freshly squeezed juice, moving up and down while she had not had any wink of sleep the whole night. You need to be so grateful to the new mother. As a partner, as a husband, this is the time when you can be maybe the one to give visitors water if they insist on coming. And for us as visitors, we need to be mindful and not to make unnecessary visits. If we're going to visit, maybe take some food for them, because you know they are having sleepless nights, so they're so tired, they're so exhausted, they can't really manage to host you as you would wish. This can be difficult, especially for our African setup, the Zambian setup in particular, but also there's a lot of good in our setup, because this is when you can have your mother or mother-in-law come over and help you maybe with holding the baby and let you have some sleep, help you with washing and cooking. So we just need to be mindful that this is a difficult time, and minimize the visits, especially the first week or the first month. And also just be really helpful if we're visiting. Let's maybe take something that may help the couple, and not expect them to be the ones of service to us when we visit. We can also strategize in terms of food preparation. Some people can freeze some food for some time, so that when you're not able to cook, you may just pick up something from your freezer and warm it, and then you can have a meal. Also stock up on snacks, because this is a period when the mother needs nutritionally dense meals to produce good quality milk. So stock up on healthy snacks, nuts, such things that can help make the milk really of good quality. But also, because you may have a lot of hunger while you're not able to do a lot of standing and cooking around in the kitchen, especially if you don't have help, it can be a good idea to stock up on different foods, whether frozen or snacks that can be readily available. Couples also need to plan as families how you are going to sleep. This is not a time for husbands especially to do every time the baby cries, the baby wants you. It's not every time that the baby is crying that he or she wants the mother. The mother may be so exhausted. Nobody can run without sleep for so many hours, so many days. So it's a time when you can have the mother express some milk and just let her sleep continuously without thinking about the baby. It can be so therapeutic. So for example, I know the leave for daddies is so limited in Zambia, for example, but this is where maybe for 2 or 3 hours after work, daddy can say, you go to sleep, I'll give the baby expressed milk from the bottle. It's harmless as long as you take precautions, and the mother can have the much needed rest. Even if she's been home all day and you were at work, sometimes the work at home is even more than what you may have at the office, because remember also that her own body is healing from the pregnancy and the delivery. Also, we need to care about our marriage, because this is the time when the problems can begin in marriage. There's this new baby that takes everybody's attention. The attention may totally shift from your partner to the baby, because it can be so overwhelming. The financial stress may set in, because diapers are not cheap, formula is not cheap. You may have new visitors, the mother-in-law and the mothers may need to come to assist, and then you have different dynamics in the home. The mental health toll that it takes is a lot, and it can be overwhelming. The woman may be going through postpartum blues. Even the husband can be going through postpartum depression. And so we need to recognize this new environment and be so graceful to each other as a couple. So we need to prepare, and you need to understand that It will take some adjustment from both of you before you can settle back in and just enjoy time with your family and the newborn baby. So as much as it can be overwhelming, it's important to just sneak in some couple time. Just check on your partner, you know, a simple how are you feeling, how are you coping. Especially for men, you may be going through a lot without anybody ever checking on you, because everybody's attention is on the baby, then the mother, and then the man is not even last, just somewhere at the back, not even considered, but you're also going through a lot. So let's check on each other as a couple, greet each other, ask each other genuinely how are you feeling, look out for symptoms and signs of depression in each other, and be each other's advocate through this period. As a couple, we are also key in identifying the people who may be of help from our families, who can visit and what they may help with, and also just ensure that you set boundaries from maybe family members that may be troublesome to deal with. You might need to protect each other so that you can transition through this time as a couple together. Sometimes the expectation for intimacy may be there sooner, but as a guide, we usually advise couples to wait for 6 weeks. But also as a general standard, we encourage the intimacy to resume when the woman is comfortable, when she feels like she's healed. With consideration for your partner and your marriage, you can resume intimacy when you are ready, at least after healing has occurred. So in summary, as couples, how we can help each other transition better through this postpartum period. Let us help each other in terms of having a few hours of uninterrupted sleep, whether it's the man or the woman. Let's set boundaries for visitors and identify people that can be really helpful, and be open to help where it is available. Let's look out for symptoms of depression in your partner, and let's have a financial plan so that we don't have financial stress, which makes us abate some of these issues in the marriage if you don't prepare well. So there you have it, ladies and gentlemen. Having a baby is a joy, but it can come with challenges. If we plan properly, however, we can be able to identify these challenges and have a plan on how we can tackle each one of them one by one, so that we can enjoy building our families together. If you found this video helpful, please follow my page for more of such content, and also share this video with somebody that you think may find this information helpful. Thank you so much.